My parents are small business owners in Portland, Oregon. They qualified for the ACA's small business tax credit and got almost $13,000 in tax credits that year, which have been extremely helpful in keeping the business going and hiring new employees.
Affordable Care Act, and of course the tax credits. All these things make it possible for a company like mine to be able to have a more attractive company. It actually allows me to pass out bonuses if I need to, or to bring in a part-time, which I've done, a part-time engineer to help out in the studio. All of these things help lower our premiums and put money back into the small businesses' pockets.
Well, the small business tax credit is something that it's only a benefit. There's no downside to small businesses. If a small business qualifies for the tax credit, they get the tax credit. Regarding businesses of more than 50 employees, they will be required to offer coverage to their employees. 96% have less than 50 employees and have absolutely no obligation to do anything different than they've been doing to date. Only 4% of all businesses in this country have more than 50 employees. 96% of those businesses already offer health coverage. They've already deemed that it's important to their business to attract and retain employees, and those businesses will be able to just keep doing that as they've been doing it to date. Prior to the passage of the Affordable Care Act, we did an economic study. It was done by Jonathan Gruber, an economist at MIT, and it showed that unchecked, total healthcare costs for small businesses would amount to $2.4 trillion over the next 10 years. And that if we implemented the type of provisions that were then being considered and ultimately became part of the Affordable Care Act, we could actually save about a third of that, or almost $1 trillion. Well, that's direct money out of the pockets of small business owners that could be more productively used in the economy to pay their workers, to invest in new products, to invest in new marketing, to help compete with products abroad.
Just in this area alone, if we achieve our targets over a 3-year period, you're talking of savings of millions of dollars. So if that's just in this one district of Brooklyn with 2 hospitals, imagine if it's across the country.
Putting forward different payment models, paying providers in a different way, rewarding quality, rewarding care coordination, based on the premise that if you pay for quality care and not just for providing more care, that eventually it's going to be in the interests of healthcare providers to keep people healthier, and so you're going to see less instances of chronic conditions and the costs are going to go down.
With the Affordable Care Act funding, $5.37 million, we will be constructing the new medical portion of our brand new Albion Street Health Center. And this funding is so important. The components of a community health center were really the most cost-effective, a cost-efficient deliverer of services within the whole federal government structure. Why? Because we provide comprehensive care, a whole bundle of services, so each client comes in for one visit. They may be seeing the doctor, the nutritionist, whatever they need to have done at that visit, so we can keep costs down.
In going to the emergency room, the cost is much, much higher than if you're able to afford healthcare and just follow with a pediatrician and not have to go to the ER for, small diagnosis like an ear infection or a cold, which can easily be managed if you have insurance.
The health law is really a jobs law, and it creates jobs in several ways. One is through modernization of the healthcare system, and we've seen through all other sectors that when you modernize, you also then create jobs. Sometimes overlooked aspect here is lifting the burden of rising healthcare costs from American businesses. Particularly small businesses who today don't have the advantages of large employers are often really crushed by the burden of healthcare spending.
When we've polled small business owners, they say that the need for more demand for products far outweighs any other concern they have in the economy. And in fact, they cite healthcare as another extremely high concern. So the efforts that the government has made to both stimulate the economy, and we know the specifics of these are very well supported by small businesses, the money going into infrastructure, the plan to reduce payroll taxes, even employer payroll taxes even further. These are things that small business cares most about.
Currently, people are paid depending on what services they receive from Medicare. So in other words, you get paid if a patient goes into hospital. You don't get paid if you keep them out of hospital. CMS, I think very cleverly, has actually come up with an incentive to enable organizations to be paid for keeping patients out of acute care where it wasn't absolutely necessary.
The Affordable Care Act and the direction it's taking us, it's really moving away from volume to value in its reimbursement system. Right now, we're paid for the volume of work that we do. So it's better to get you in a lot of times because we'll get more payment. Well, that system doesn't work for anybody. It doesn't work for the payer. It doesn't work for the patient. The patient would rather be paid, and the payer would rather pay for value, which is to say that I want to pay for you to be healthier. And I'll align all of our payments to make sure, and I'll bundle our payments so that people can have better outcomes. And that's the direction that the Affordable Care Act is taking us.
One of the very first things we do is a medication reconciliation. Now, we've set up this program in such a way that the hospitals that we're working with are having a pharmacist review those medications before they're discharged home. But our coach, when they go into the home, will actually say to the patient, show me what you're taking and how often, because that may differ from the sheet that you're given with the discharge instructions. And I cannot tell you how many times we have discovered in that process that things have been left off the discharge sheet, or things were added that shouldn't have been on there that the patient had been taken prior to their first admission to the hospital. The whole purpose is to try and prevent an unnecessary rehospitalization. And we are confident, because this has been tested out in other parts of the country, and we're beginning to see early results ourselves. With this kind of follow-up, patients are not automatically reaching out to the emergency room at the first point of call when they're beginning to experience some symptoms.
So with the Affordable Care Act, for example, having basic preventive procedures at no cost is a huge boon. Colonoscopies, for example. More people can be screened now for colon cancer because there isn't a copay. You don't have to pay $100 or $150 for that test. It's all steps to move the nation to a larger plateau, to a plateau of prevention, a plateau of wellness. And when you have that, you save money because it's not about acute care delivery, it's about preventive care delivery.
The whole CCTP approach, one is having the community-based organizations lead, which I think says a lot, particularly coming from CMS, which is a government body and certainly top-heavy in terms of structure and organization, really looking to community-based organizations. In other words, going right back down to the roots of any community, because I think they've recognized solutions are not always those that are coming from on high, from government, but actually grow up from the communities where they know the local conditions, the local needs, and have a better understanding of the local resources available. While they had certain criteria for inclusion in the project, they haven't been proscriptive in the way you have to design this.
Well, right now, small businesses pay on the average 18% more than big businesses for this exact same coverage. The biggest reason for that is big businesses have the buying power to negotiate more favorable rates with healthcare insurers, and they have the economy of scale to make sure that to lower their administrative costs. Once those exchanges are up, the employers and the employees it'll be much easier for them to go, and the employer can register their employees on the exchange, and the employees will actually be able to go and have a much greater choice of products, again, much the way a big business plan might have.
With regard to our school-based clinics, we're now in 6 schools, and we were able to receive about $166,000 under the Affordable Care Act. The point is so a parent doesn't have to take time off from work if a child is sick or needs routine care. We become that routine source of care right in the school.
The federal government is acting with the Affordable Care Act in places where it's necessary for the national government to provide a national solution to national problems. And where possible, the Affordable Care Act gives significant discretion to the states. That's the best of our nation's federalism, providing a national mechanism for reform when states can't address the problem on their own, and yet giving flexibility to the states to take advantage of the states' closeness to their people, being able to craft policies that reflect the diversity of America's people and places.
Jax is 7 months old now, but when I was pregnant with him and his twin brother, I found out that he had a congenital heart defect that goes along with a genetic disorder. We would move mountains to pay for life-saving health care for my child and for his brother and his sister, but that we don't have to is the financial security that comes along with this law makes a world of difference for my family.
I have been in treatment now since the 1st of December. I'm in the middle of my chemotherapy treatments, and within a couple of months I should be done with the bulk of all of this, but it's all because of the Affordable Care Act.
We're worried again because if the Supreme Court gets rid of the health care bill, my daughter will never be able to get health insurance again for the rest of her life because she has asthma, post-heart condition, all of these many things.